being discharged by this kind of patients. Sometimes they may exhibit vomiting. Vomiting is another clinical presentation, and because of vomiting, this patient will end up having dehydration. Dehydration comes because of diarrhea, which is profuse. That means the patient loses a lot of water, and because it's vomiting every feed, and those again, when each and every individual is vomiting, we expect again to lose water, which in our language we say dehydration. Despite dehydration, this individual again will exhibit as well of abdominal cramps. Abdominal cramps because the GIT is a bit upset, so they immediately try to compensate with those kind of reactions, of which most of the time is like immune response trying to clear out those kind of bacteria. In so doing, trying to clear out, then abdominal pains will be experienced. In addition to that, there will be fever. In each and every individual where there is a bacteria or any foreign body that has entered in the body system, individual will exhibit some fever as a natural response against the foreign body that has entered in the system, and no wonder this patient will exhibit with fever as a clinical presentation. These are some of the clinical presentation of cholera, on which there are others like when the individual has dehydrated, we always have poor skin tagger, because especially in pediatric group, there is a poor skin tagger to the extent that you are able to pull the skin, and it is very, very, very the kid might also experience will be like lethargic, very lethargic, poor skin tagger, as well as having an urge to drink a lot of water. However, because of vomiting centers are being triggered, they end up vomiting now and then. Those are some of the clinical presentation of cholera. Sure.
It seems that every disease has complications, as we said earlier. Now, what are the complications of cholera?
Cholera might complicate in 2 or 3 areas. In this case, number one complication is dehydration and the electrolyte imbalance. Dehydration comes because this patient, as we said, that he or she vomits, he or she has got the diarrhea, which is very profuse and watery, and this patient again has got fever. Everything is adding to nothing by dehydration. When the patient is dehydrated, obvious electrolyte balance is compromised, which we are calling electrolyte imbalance. That means the salts in the body system like sodium, chloride, as well as potassium, they get deficiency. And so it's what we are calling electrolyte imbalance. So if these electrolytes are in imbalance, will result into nothing but shock, and even in dehydration can result into shock as well. So shock is another complication despite dehydration and electrolyte imbalance. If this shock has arisen, it has got the following. It may result into other organ failures like kidney failure, because the kidney will not have enough supply of enough supply of electrolytes, which makes it to kick the way it is supposed to kick. Even the lungs are being again compromised and resulting into nothing but respiratory distress. Since we have said that this patient will always exhibit with fever. So if the fever has been encountered, fever is a sign that the body system has been engulfed by the bacteria. As such, when the bacteria, there are many in our body, we call it septicemia. While the presence of bacteria in the blood system is septicemia, while overall term is sepsis. All the septicemias respect the distress, kidney failure, shock, as well as dehydration and renal balance are some of the complications of cholera, which is caused by Vibrio cholerae. In this case, we're talking of 01 strain. That's how we can summarize in as far as a complication of cholera is concerned.
Okay, as we're going to the end of our program, now let's now look at the preventive measures. I hope this disease is preventable. Mr. Josam, how can we prevent this disease?
It is a common medical thing. We say always that prevention is better than cure. Initially, cholera being a waterborne disease, we need to have safe water and sanitation.
Yeah.
That is the first bullet to in line with prevention. When we have got safe water and a very good sanitation measures, we are likely to have a very good chance of preventing the occurrence of cholera. Number 2 is proper hand washing. Proper hand washing will help us to eliminate the Vibrio cholerae, which causes the cholera from transmitting from one person to another, and so doing we have prevented it. In addition to that, food safety and handling. Being waterborne, we know that we cook our food using water. As such, when we are handling our food, we need to be very careful in terms of how we are washing our utensils, what kind of water are we using, what kind of water are we using, are they clean water, are they safe water. The water that we are using to handle our food should be safe enough so that we should prevent transmitting the infection, in this case the Vibrio cholerae, from the cooking point to the ingestion point, which will help us to prevent the Vibrio cholerae, which causes the cholera.
All right.
In addition to that, again, as it stands of now, we are in the phase of trying the cholera vaccine. The cholera vaccine being used as of now under WHO, there are all vaccine, cholera OCV. Of course, there are other ones, there are the Ducaros, the Chanuzals, and the Vasculars. All these vaccines, 4 of them, they are being under trial. They are not yet being gazetted in the WHO, even a Center for Disease Control and the other resources that they handle much in line with outbreaks or health conditions in line with water and sanitation. We call it WASH. So for the vaccine is under trial. As such, when it is well implemented, it shall be given according to their prescription in as far as vaccination is concerned.
Okay.
So that's how we can prevent some of the measures that to prevent cholera.
All right, Mr. Josam. As Mr. Josam said, cholera is a deadly disease, as we all hearing him saying that. So listeners, I think let's follow these preventive measures to avoid being a victim of cholera. Some of the preventive measures are safe water and sanitation, and also we need to make sure that our food is safe in terms of handling, and also proper hand washing, and avoid contaminated food and water. Okay, Mr. Josam, this disease, I'm sure, as we've been discussing a lot of the past medical conditions, this one also has its treatment. Now, can you take us through the treatment of cholera?
Although there is no prescribed treatment for cholera, however, there are other measures that are taking place so that we can combat cholera. The first measure is to supply oral rehydration therapy to the patient who has been affected by cholera. That should be given orally. So the patient is supposed to take the thing in sips. Should not be too much, should not be too little, because too much can trigger vomiting symptoms. Long at last, it ends up him or her vomiting, which we are again putting him or her on risk of dehydration. Number 2 is intravenous fluids. These fluids, they are synthetic fluids that are supplied at each and every health facility where the patient is a bit dehydrated or completely dehydrated, and is given intravenously. These fluids are never taken orally, but they are given intravenously with an aim of rectifying dehydration. And there are calculations that are used to measure how much this patient requires, again by checking dehydration markers like sunken eyes, skin turgor, as well as cold, clammy hands. If all these parameters, like if the patient has got sunken eyes, we need to give a lot of fluids till when the sunkenness is has a bit improved, as well as skin turgor has improved, and the clammy hands has improved. So that is one way of giving or providing the treatment to the patient of cholera. Number 3 is provision of antibiotics. These antibiotics are given when the patient is a bit qualifying to take oral fluids, or water can be given orally. If the patient is able to take water orally, then and we monitor the hydration status of the patient as well as other markers, then we can be able to give the patient antibiotics. The most antibiotic of preference is doxycycline, or you can interchange it with azithromycin. In doxycycline, the prescribed dose should be 100 mg. In adults, we give 100 mg every 12 hours, depending on the situation of the case, but much of the time is given 5 days or 10 days, depending on the severity of the condition. While azithromycin is a start dose, depending on the manufacturer's milligram or manufacturer's instruction. Those are some of the ways how we can prevent or the treatment of cholera.
Let me thank you once again, Mr. Josam, for joining us in this program. Let me thank you also, listeners, for being there to learn. This marks the end of our program. Be there again next time, as we will be coming again with other medical conditions on Health Issues podcast. You were with me, Livness Mtyoga, the editor and the presenter of this program. Be there and stay safe.